Hello, this is Anudeep, a second year medical student. Can you please confirm your name and age, please? This is Mandeep of age 21. Mandeep, okay, today we are going to examine your sensory system. Will that be okay with you? Okay. Okay, we'll start in a couple of minutes. Okay. Firstly, begin the examination by assessing pain sensation in arms, legs, and trunk. To do this, first warm the patient and then use the sharp end of a cotton swab. And now ask the patient to close his eyes and starting with the arms, test the scattered areas in a symmetric pattern on both sides of the body, occasionally substituting the blunt end for comparison between sharp and dull. And now, after the examination, discard the broken swab after using it. Next, assess the light touch with a cotton wisp. Prepare a fine cotton wisp and ask the patient to slowly close his eyes and ask him to respond whenever he feels it. Starting with the arms, test the scattered areas in a symmetric pattern on both sides of the body. Discard the cotton swab after using it. And now assess the vibratory sensation. For this, use a lightly vibrating low pitch tuning fork. Tap the tuning fork on the heel of your hand and place it against the distal tissue of finger and also the large toe and ask the patient what he feels. And now ask the patient to tell you when the sensation stops. Also, move the tuning fork closer to the trunk to see if it is perceived. Now, to test the position sense or proprioception, hold the sides of patient's big toe with your thumb and index finger. Avoid touching other toes. Next, ask the patient to close the eyes and identify the direction of motion. Repeat this several times on each side in an irregular sequence and then repeat with the same with the big toe of the other foot. And again, with the patient's eye closed, test the position sense in the upper extremities as well. Beginning with the finger on each of the patient's hands and moving more approximately to metacarpophalangeal joints and even beyond if indicated. Stereognosis, the ability of identifying an object by feeling it. Now, ask the patient to close his eyes, then place a familiar object in the palm and ask the patient to identify it. Repeat the same with the other hand, but this time with a different kind of object. Now, to test the graphesthesia, it's a number identification. Ask the patient to close his eyes and use a blunt object to draw a large number on the palm. See if the patient can recognize the pattern that you have drawn on his hand. Try it with a multiple number of numbers or even letters and see if the patient can identify those or not. Normal patient can identify this. For the 2-point discrimination, using two ends of an open paper clip or ends of the two pins, touch the patient's finger pad with 2 points simultaneously and with 1 point occasionally. And also make sure that you do not cause any kind of pain for the patient. Ask the patient to identify if he is being touched with 1 or 2 points. Then reduce the distance between the two pins so that you can determine the minimum distance at which the patient identifies the 2 points. For the point localization, ask the patient to keep the eyes closed and then touch a point on the patient's skin. Ask him to open his eyes and then ask him to point out to the place touched. This test is especially helpful for locating sensory loss on trunks. Further extension, use your fingertips to provide stimulus in either one area of the patient's body or in two areas simultaneously. Normally, patient should be able to identify whether your stimulus was on one side or also the both sides. And now begin assessing deep tendon reflexes by testing the biceps reflex. The patient's arm must be relaxed, partially flexed at the elbow and positioned with the palm down. Depress the biceps tendon with your thumb or index finger. Strike your thumb or finger briskly with reflex hammer. And now you should be able to see the biceps muscle contract and see flexion of the forearm. And now repeat the same procedure for the other side of the hand as well. And now to assess the triceps reflex, flex the patient's arm at the elbow with the palm towards the body and pull the arm slightly towards the chest. Strike the triceps tendon above the elbow. Watch for the contraction of triceps muscle and extension at the elbow. And now, to elicit the supinator or brachioradialis reflex, the patient's forearm should be rested on the abdomen or lap with the forearm partly pronated. When the patient is ready, strike the radius 1 or 2 inches above the wrist. Observe for the flexion and supination of the forearm. Repeat the same for the other side of the hand as well. And now, to test for the knee reflexes, locate the patella tendon with the patient's knee flexed briskly. Tap the tendon just below the patella. Note the contraction of the quadriceps and look for the quick extension of the knee. A hand on the anterior thigh let you know to feel this reflex. And now, supporting both the knees at once allow you to assess the small differences between the reflexes of each knee. Just tap briskly on both the knees. Now, to test for the ankle reflexes, have the patient in the sitting position and dorsiflex the foot at the ankle and ask the patient to relax and strike the Achilles tendon. Now, watch for the plantar flexion of the ankle and note the speed of relaxation after the muscle contraction. If the knee and ankle reflexes seem to be hyperactive, test for the ankle clonus. Support the knee in slightly flexed position and with your other hand dorsiflex and plantar flex the foot a few times and then sharply dorsiflex the foot and maintain it in the dorsiflexion. Look for the sustained rhythmic oscillations between the dorsiflexion and the plantar flexion. In most normal people, the ankle does not show clonus. A few clonic beats may be felt, especially when the patient is tense or exercised. Now, for testing this cutaneous stimulation reflexes, we need to test lightly but briskly stroke each side of the abdomen from above T8 to T10 and below T10 to T12. Now, you should see the contraction of the abdominal muscles and sometimes elevation of umbilicus towards the stimulus. And finally, to test for the plantar responses, use an object such as wooden end of an applicator stick or the handle of your reflex hammer to stroke the lateral aspect of the sole of the foot from the heel to the ball, curving medially across the ball. Warn the patient that this may feel uncomfortable. Use the lightest stimulus that provides a response. Note the patient's normal response, whether it can be plantar flexion or downgoing of the big toe. A positive test indicates a corticospinal tract lesion in a stroke. So that completes the entire procedure and everything is fine. Thank you.